Title: Pre-eclampsia, Understanding the Risks, Symptoms, and Treatment. Opening shot: a pregnant woman sitting in a doctor's office, looking worried. Narrator: pregnancy can be an exciting time, but it can also come with its challenges, including the risk of developing pre-eclampsia. Cut to an animation of the circulatory system. Narrator: Narrator: pre-eclampsia is a potentially serious condition that can occur in pregnant women after 20 weeks of gestation. It is characterized by high blood pressure and protein in the urine, and it can lead to serious complications for both the mother and the baby. Cut to a doctor in a hospital room. Doctor: pre-eclampsia can cause damage to the mother's organs, including the liver and kidneys, and it can also lead to poor fetal growth and premature delivery. Cut to a woman in a hospital bed, hooked up to machines. Narrator: symptoms of pre-eclampsia include high blood pressure, swelling in the hands and face, proteinuria, and headaches. Cut to an animation of the placenta. Narrator: the exact cause of pre-eclampsia is not known, but it is believed to be related to problems with the blood vessels in the placenta. Cut to a doctor holding a syringe. Doctor: treatment for pre-eclampsia may involve medications to lower blood pressure and prevent seizures. In severe cases, early delivery of the baby may be necessary. Cut to a woman holding a newborn baby. Narrator: with proper medical care, most women with pre-eclampsia go on to have healthy babies. However, it's important to seek medical attention if you experience any symptoms of the condition. Closing shot: a happy family leaving the hospital with a new baby. Narrator: if you are pregnant and have risk factors for pre-eclampsia, such as a history of high blood pressure, obesity, or multiple pregnancies, talk to your healthcare provider about ways to lower your risk and monitor your health throughout your pregnancy. Early detection and treatment of pre-eclampsia can help ensure a safe and healthy pregnancy for both you and your baby. Regenerate response. Send a message. ChatGPT March 23 version. Free research preview. ChatGPT may produce inaccurate information about people, places, or facts.